Good afternoon, and welcome to this edition of Disability Chat. In this session, Allison Bartlett, HDSA's resident disability expert, will talk about VA benefits and Social Security. You can send a question at any time during the presentation. Just click on the chat function in the toolbar, type your question, and press send. Your questions will be seen only by HDSA. This presentation will be available in about a week on HDSA's YouTube channel. And now a little about our presenter. Allison Bartlett is the manager of disability programs and is a disability attorney who specializes in representing clients with rare chronic conditions like HD to navigate the complex disability system. Allison holds a JD from the University of Cincinnati College of Law. And now I'll turn the chat over to Allison.
Thank you, Deb, and thank you everyone for joining me today. As Deb mentioned, I will be going over VA benefits and Social Security, specifically understanding veterans' disability benefits in HD, getting HD care from a VA hospital, and how to get dual VA and Social Security benefits. So the overview of what I'm going to talk about today is going over a little bit of detail about veterans' benefits themselves, the eligibility criteria for VA disability benefits, an HD diagnosis and VA disability benefits, Social Security benefits and VA benefits, VA medical care in HD, and VA benefits in HD. And it's important to understand both sides of this to understand how they fit together. And I'm going to preface this with I am by no means an expert in VA benefits, but I'm going to share with you what I have learned and how best to work with HD families throughout this process. So the very first thing, what are veterans benefits? Specifically, they are benefits provided by the U.S. Department of Veterans Affairs for retired or separated armed forces personnel and their dependents and survivors. So these include educational assistance, healthcare, assisted living, disability, home loans, and insurance. And as an outsider to the VA process, it's important for us to talk about these and kind of have an awareness of what the VA does provide, just because there are so many veterans and people who get VA benefits, but are also entitled to other benefits. So it's really important to know how everything works together, which is why I'm giving this presentation today. So who are these benefits for? They're for all active duty U.S. uniformed services, which includes the Army, the Navy, the Marines, the Air Force, the Space Force, yes, that really does exist, the Coast Guard, and the active National Guard and Reserve. Then they're also eligible for certain retired and discharged service members. In order to be eligible for these benefits, you have to have an honorable or a general discharge. Dishonorable and bad conduct charges may bar VA benefits. There is a way to argue for a review of a dishonorable discharge, but I'm not going to talk about that. I just wanted to make anyone on this presentation aware that that is an option for somebody who was dishonorably discharged and has questions about it and wants to get some of these benefits to see if they can in the future. So veterans' disability benefits, who are they for? They are for veterans who got sick or injured while serving in the military. This is called service connection. This service connection idea is essential to veterans' disability benefits. And it's going to be really important in this conversation and moving forward and understanding HD and veterans' disability benefits. But service connection means that the injury or illness either happened because of military service or was made worse because of military service. That's what the next bullet says. So what conditions are eligible? This pertains to physical conditions and mental health conditions. Both of these categories work for disability benefits. And does the condition have to appear before military discharge? No, that's another important thing to know. So what do veterans' disability benefits include? It includes health care, and it includes a monthly tax-free payment. The monthly tax-free payment is really important to recognize because there are no limits. It's just monthly tax-free payment. With Social Security disability, money is only tax-free until $25,000 for an individual or $32,000 for a married couple, which means there's a lot of individuals who receive Social Security disability insurance who are actually paying taxes on it. So how do veterans go about getting their disability benefits? They will need to submit a claim for disability and submit supporting documentation. So very similar to having to file a claim and submitting supporting documentation for Social Security. Veterans have to show two things. that their illness is at least 10% disabling, and it appeared within 1 year after being discharged from active service. And then both of these must be true, that the veteran has a current illness or injury that affects their mind or body, and they served on active duty for training, or in active duty training. That is the service connection part of the disability. And then at least one of these must be true. The veteran got sick or injured while serving in the military, and the service has to link this condition to your illness or injury, so it has to be an in-service disability claim. The other option is you had an illness or injury before you joined the military, and military service made it worse, or you have a disability related to your active duty service that didn't appear until after your service ended. So again, it has to be service related. There are things that are presumed disability, so those include illnesses that appear within 1 year after discharge. And what will happen is the VA will conclude that symptoms that appear within 1 year of a discharge are related to military service. It has to be an illness listed in Title 38 Code of Federal Regulation 3.309. I'll give some examples on the next slide. And the person did not receive a dishonorable discharge. And a lot of these are they're presumed disabilities because it's an illness caused by contact with contaminants, toxic chemicals, or other hazardous materials, or an illness that was caused by time spent as a prisoner of war. Some of these don't happen as often anymore, but it's still important to know that these are things that do happen and how to get veterans disability. So some of the things that are included in Title 38, some of the things that are considered a presumed disability, that if you have any of these things that appear within a year after your discharge, you're going to get veterans disability. So things like anemia, arthritis, muscular atrophy, brain hemorrhage, brain thrombosis, cirrhosis of the liver, diabetes, encephalitis, endocarditis, epilepsies, Hodgkin's disease, leukemia, lupus. There were others. I did not include things on this list that I could not pronounce for the webinar. I didn't want to have to deal with that. Like I said, all of these things are listed in Title 38 of the Code of Federal Regulations, so it's pretty easy to pull up. There are also some time exceptions. The following diseases are covered even if they appear more than 1 year after a person separated from the service. So if somebody is diagnosed with one of these 4 things and they're a veteran, they will automatically qualify for veterans disability. And that is Hansen's disease, that can appear within 3 years after discharge. Tuberculosis can appear within 7 years after discharge. Multiple sclerosis can appear up to 7 years after discharge. And if somebody is diagnosed with ALS, it can appear anytime after discharge. And I know when we're talking about HD, we also talk a lot about parity with things like ALS. The reason MS and ALS have these time exceptions and extensions is because MLS and ALS are both triggered by environmental factors that are commonly experienced during military service and war. These exceptions exist because there's a much higher percentage of veterans who end up with multiple sclerosis or ALS than in the civilian community, which is why these exceptions exist. Okay, so we've just talked about a little bit how somebody can get, or how somebody is eligible for veterans disability. So veterans disability definitely works differently than Social Security disability because they have a rating system. With Social Security disability, you're either disabled or you're not. With the VA, there's a rating system. So ratings are assigned based on the severity of the disability. Ratings represent how much the disability decreases health and ability to function. And that's why, one of my earlier slides, it said you had to have at least a 10% disability. A 10% disability or more is when you will actually start getting a monthly financial payment. And the disability rating is used to determine compensation rate and determine eligibility for other benefits like VA healthcare. The rating is based on the evidence provided, so doctor's reports and medical tests, results of a VA claim exam, and information from other sources, like other federal agencies. So VA disability ratings go from 0% to 100%. And they impact things like health insurance priority level, which impacts a copay amount. There are priority groups 1 through 8. And I'm not going to go over all the priority groups here, but priority group 1 has the lowest copay. These are for individuals who have a service-connected disability of 50% or more, or they have something called total disability based on individual unemployability, which I will talk about a little later. So VA individual unemployability is a nice benefit because it's designed for veterans who cannot work because of their service-related disability. And it's a nice program because it's been created for individuals who don't have 100% service disability, but may not be able to work otherwise. So in order to be eligible for VA individual unemployability, you have to have at least one service-connected disability rated as 60% or more disabling, or you can have 2 or more service-connected disabilities that add up to a certain rating amount. And how this works is you can't hold down a steady job that supports you financially, known as substantial gainful employment. I talk about that, substantial gainful activity with Social Security. And the reason you can't work is because of your service-connected disability. And it's really important for people to know about this program and veterans to know about this program because a finding of unemployability comes with additional benefits. It increases a monthly benefit amount. It includes dental insurance. A lot of veterans don't have access to dental insurance that's not covered under the VA unless you meet certain criteria. And if you have this dental insurance, you qualify for any needed dental care. There aren't like limitations. Certain veterans only qualify for certain dental care related to their service-connected injury, but this covers all dental care. And it can improve health insurance priority level by having a finding of unemployability. And the reason it's really important for veterans and other people to know about this program is because this is a better option than having the entire disability reevaluated. Because you can go back to the VA and you can have them reevaluate your entire disability status, but what can happen is your disability can improve and it can mean you have a lower rating. A lowered rating would reduce monthly benefit payments and could change healthcare priority and raise copays. So let's say you're a veteran, you have a disability application go through, you're given a 60% rating, you get discharged from the military, and you go out and you try to find other work, see if there are other jobs you can do. If you've discovered that you can no longer do other work, at that point, then you would want to apply for individual unemployability because that's going to also be a little bit easier of a process than trying to get your whole rating reevaluated. So now that I've talked a little bit about veterans disability, and now I'm going to talk about veterans disability and Huntington's disease. So can someone with HD get VA disability? Yes, they can, but it's generally not for their HD. In order for someone with HD to get VA disability because of their HD has to start impacting them while they're in the service, and they receive an HD diagnosis while they're in the service, and they're getting treatment for their HD. So again, there has to be that service connection. It has to happen while they're actively serving in the military. Do veterans with HD get VA disability because of their HD? Like I said, it's very few, and it's because of the service connection requirement. And the service connection requirement limits the number of HD individuals who get VA benefits because of HD. Has it happened before? It has. Does it happen very often? No. Most veterans with HD do not start to show signs or symptoms of HD until after their service is over, so they cannot show service connection. Or they are not aware that it's HD, because a lot of earlier symptoms of HD look like depression, anxiety. It can be tied with PTSD. And so those are the things somebody's more likely going to get treatment for and may get a VA disability for. It could be possible to show that events that occurred while in the service could progress onset of HD, so it could mean an earlier onset, but I'm not sure if anyone has attempted that argument, and so I don't know if it works, just based on conversations I've had with other individuals who work in the VA system. That is something that could possibly be attempted. Not sure how effective it's going to be. Usually how it works is there are a lot of HD veterans that have VA disability for other conditions, but they don't have it for HD. So what that means is they are in the service, they have some other condition that happens, whether physical or mental. A lot of times I've seen that it's depression, anxiety, or a combination of PTSD. They get discharged from the military as a result of their VA disability, and then they go on to work. And so that's where there are other options. So if somebody is discharged from the military, even if it's for a VA disability, they have other options, because a lot of service members leave the military by the time they're in their early 30s. This means that they find work and pay into other disability programs. This is either private disability through their employer or it's Social Security. This includes a lot of veterans who are also receiving some kind of VA disability. The average VA disability rating for all veterans is only 10%. And so that means if they have a 10% disability rating, they should be able to go out and find other work. Like the assumption that veterans with a disability rating between like 0 and 60% could find work outside of the military. So that means they pay into the military, they're eligible for like veterans and other benefits while they're serving. They leave the military, they go find other work, they pay into a different disability program, they are then eligible for that disability as well. And a lot of individuals with HD fall into this category, veteran. So they leave the military service and then they go work and pay into Social Security separately. So how does this impact veterans? VA disability and Social Security disability are two completely separate programs that have no impact on each other. Veterans can get VA disability and Social Security disability at the same time with no reduction in benefits. There are other programs, like if you get workers' comp, that could reduce your Social Security disability amount. VA disability is not going to reduce Social Security disability and vice versa. It's really beneficial to get both programs if somebody is eligible for both programs. So what are some important things to know, especially because veterans disability and Social Security disability are two completely separate programs? If I have VA disability, does that mean I will automatically qualify for Social Security? No, the programs are completely separate and have their own criteria. This is really important for veterans with HD to know. Why? It's because if they have VA disability for different conditions, their records will not help them with a Social Security disability claim for their HD if their VA disability records have no mention of their HD. That being said, should I submit VA disability records with my Social Security claim? Yes. VA records can be really helpful for a Social Security disability claim if multiple conditions are included in the Social Security application. So let's say somebody's applying for their Social Security disability for Huntington's disease, depression, and anxiety, and this person also has a VA disability for their depression and anxiety. In that case, they would 100% want to include their VA records because it's going to be relevant for their Social Security claim. But if this is somebody who is only applying for Social Security for their HD, there's absolutely no record of their HD at all or any cognitive conditions while they were serving in the military, their VA records might not help them because there's not going to be anything in there that Social Security is going to need. It's possible, so there's no harm in submitting the VA records, but there's no guarantee that they would be helpful in a case like that. So here I wanted to show the differences between VA disability and Social Security disability. For VA disability, you have to have a current illness or injury, whether mental or physical. You have to have served on active duty for training, or inactive duty training. You have to be able to link your illness or injury to your service, and you have to have medically documented symptoms and limitations. That is definitely different than the Social Security criteria. For Social Security, you have to be making less than $1,350 per month. You have to have a condition that'll last 12 months or longer. You have to meet or equal one of Social Security's listings, and you also need medically documented symptoms and limitations. But having this little chart and looking at this, it's very clear that these kinds of disability are very different. And it's really important to stress that these programs are different because somebody who has VA disability cannot assume that if they're getting care through the VA, that the VA knows how to complete a Social Security disability application. That is not an assumption anyone should have because it's not true. Being a specialist, I personally specialize in Social Security disability. I don't know anything about the VA disability process, not really, because they're so separate. And so that has to be We have to stress that these programs are very, very separate. Just because you know one does not mean somebody is going to know the other. And VA complexities can make it harder for veterans to get Social Security disability, especially if it's somebody with HD. And the reason for that is many veterans receiving VA medical care may already have a VA disability. And so a physician tracking their care isn't necessarily thinking like, oh, I have to help them get disability again. No, and because there is a difference in the way somebody needs to notate medical records if somebody has disability versus if somebody may need disability. VA physicians are likely not thinking about how to write medical records for a Social Security disability application, which again has completely different criteria. And not all veterans are eligible for Social Security disability. The VA system is very insular and isolated. Like everything in the VA is for the VA. They're not necessarily thinking about other agencies, organizations, or programs and how to help veterans get benefits through those programs because there's so many benefits offered within the VA itself. Only veterans and their families have access to VA care, and that's not every veteran, their family can access VA care either. Like I said, VA programs are extensive, so they don't often need to refer people to outside programs. They don't always think about it. And again, another thing that's important to think about is it's important to educate VA physicians about HD. There are physicians within the VA that provide HD care, but there are not many. And it's really important to know that because the VA is massive. There's 1,221 VA outpatient sites. There's 300 VA vet centers and 144 VA hospitals. So there's a lot of resources across the country, but not all of those facilities have someone that specializes in HD. And why? Because HD is really rare and requires very specialized care. And not every HD family is going to have access to a local HD care provider. So while preparing for this presentation during my research, I found that there are care centers, like there are physicians in Raleigh-Durham, Nashville, South Carolina, and Oregon that work both at a center of excellence and at a VA hospital. So that means that they can get specialized care from both places. That's not true across the country. And because not every physician is able to treat HD and not every physician is going to know Social Security regulations, HD individuals who are both veterans and have HD should not assume that a VA physician is going to know Social Security disability criteria. It is safer to assume that they do not know the criteria, especially because Social Security is not part of the VA system. It's also important to educate VA physicians about the Social Security disability process and requirements if the individual is only getting care from the VA. Families do need to let their providers know if they plan to apply for Social Security, and that's true whether you're just getting VA care or you're going to see a center of excellence. You have to let your doctors know where you are in the disability process, what you're planning, and what you need help with. Families also need to have conversations about what is documented in their medical records, and they have to be honest about their symptoms and limitations. And again, this is true whether you're getting VA care or care from a center of excellence or someone else. And it's so important to stress this, especially veterans getting Social Security as well, because Social Security disability benefits are necessary for so many veterans. There are currently about 17 million veterans, and 953,000 of them are receiving Social Security disability. I will say these statistics are from 2016, but I think it's because the VA and Social Security only do a report like this every 10 years. The other really important thing to know is that for 50% of veterans receiving Social Security disability, it is the difference between poverty and financial stability. So a lot of veterans who are receiving Social Security benefits depend on these benefits. So we need to make sure that veterans get the Social Security disability benefits that they need. Because if none of us on this presentation are working in the VA system, we can't really do a lot to help veterans get VA benefits because, again, like I said, the VA is very isolated and insular, and you need to speak to specialists who understand the VA processes. I don't. But I really just wanted to stress that veterans also really do benefit from Social Security benefits and need them. So I want to make sure that when we are providing care, to people who have HD and also are veterans, they get everything that they need. When talking about veterans who also happen to have HD, it's really important to also discuss what to consider for HD care because that's relevant whether you're a veteran or not. So veterans with HD also need to consider specialists. They need to see a neurologist or a psychiatrist. HD care requires care from a specialist, and you want to make sure your specialist is covered by your insurance. If you're a veteran who has VA insurance, that's kind of more of a given, but that's also going to be relevant with some information I'll talk about later. And there are only a handful of neurologists that actually specialize in the care and the treatment of HD, and I want to stress that. Nothing I have said in my presentation or will say is to indicate that the VA cannot provide quality care. That's not what I'm saying. What I'm saying is HD is such a rare condition and it's very specialized, so it's really beneficial to find the right person to provide the necessary care. The VA does not specialize in the treatment of Huntington's disease. The VA specializes the treatment of veterans. Only a small portion of veterans have Huntington's disease. That being said, the VA does have a lot of neurologists. Most neurologists do not specialize in HD care. The VA provides care across the country, but it's important to recognize that more rural locations will have fewer resources and limited access to things like a neurologist. When I mentioned all of the different VA care centers, they don't all provide the same care at every facility. Families are likely going to have to advocate for themselves to get the specialized HD care that they need, which means they may have to talk to multiple people within the VA and outside the VA to know what resources are available to them, because it can be really hard to know all of the resources that are available. So things to be aware of when it comes to VA medical care for an HD family. So common medical testing for HD includes gene testing, neuropsychiatric testing, cognitive testing, physical therapy evaluations, occupational therapy evaluations, and speech therapy evaluations. Everything I listed are things that are included with HDSA Centers of Excellence care. The VA does not provide the same level of HD care as a Center of Excellence because Centers of Excellence are specifically created to provide a high level of specialized care for HD families. Again, not saying it's not still good care from the VA. But the VA has different rules and requirements. You're not required to do genetic counseling through the VA. They do not use the Unified Huntington's Disease Rating Scale, which is something that is used with the Centers of Excellence, like track HD and its progression. And another thing to think about, like neuropsych testing is not available at every VA facility. It's really easy to get at some, like some of the bigger facilities, but it's not going to be available at others, like more rural communities. So you might have to get referred out to a facility that's farther away, or it might take longer to get a referral. So where are places that veterans can get care related to their Huntington's disease within the VA system? A really great program that the VA started is they're called PODREX. They're the Parkinson's Disease Research Education and Clinical Centers, and they provide care for a variety of movement disorders. They are staffed by internationally known movement disorder specialists, neurosurgeons, psychiatrists, psychologists, nurses, researchers, educators, and social workers. These are located in 6 cities across the country: Philadelphia, Richmond, Houston, West Los Angeles, San Francisco, and Portland/Seattle. It is important to note that these locations also do happen to align with locations where HDSA has centers of excellence. In these programs, they assist veterans in effectively managing PD and other movement disorders by way of VA pharmacy benefits, physical, occupational, and speech therapies, medical equipment, surgical services, and other valuable resources. So this can be a really good place to start for veterans to access care. Is it going to be perfect care because it's a Parkinson's Center, a PODREC that's designed more for Parkinson's disease? No, but they're going to have a lot of wonderful specialists and access to resources that veterans aren't necessarily going to get at other facilities. Another really great thing that the PODRECs have done is they have consortium centers because they're aware that veterans don't just live in those 6 cities or have access to those 6 cities. The consortiums offer specialized care to veterans who cannot travel to the PODRECs. There are 51 consortium centers that work collaboratively with the PODRECs to ensure the highest level of care. And then something I discovered is that Dr. Burton Scott he's the director of the HDSA Center of Excellence at Duke, and he also works at the Durham VA Medical Center. And there are other neurologists in the HDSA COE network that also work at VA hospitals and clinics. So there are HD specialists who are seeing veterans and who are working collaboratively with them and the VA. But I think what happens a lot of the time is when these neurologists see veterans with Huntington's disease, if they can, they try to make sure that they actually get care at the HDSA Center of Excellence because more specialized care is provided. And then for any veterans who don't have access to a consortium either, telehealth is a really good option for veterans because the VA network is a federal network, meaning you don't have to worry about state lines and state criteria for those things. It's much easier for veterans to have telehealth visits. This can help veterans get care from a local neurologist and more specialized care from a neurologist at like a consortium or a PODREC. Another thing that veterans have access to is they can utilize outside referrals. Veterans can be referred for covered care outside of the VA. This is possible if the wait time for care is 20 days or longer, or possibly to get specialized care. Veterans can and do get care from HDSA Centers of Excellence. And likely they probably should get care from an HDSA COE when one is available because of the specialized nature of the care. Again, the VA is specialized in treating veterans. Most veterans don't have Huntington's disease. Huntington's disease is very separate and requires additional specialized care. The VA offers excellent care in certain areas, but you're not going to go to see a podiatrist if you need brain surgery. Like, it's important to get specialized care for a very rare disease if you have access to the specialized care. And then there are some barriers to care for veterans. There's a lack of awareness of resources and options. There's also mistrust of the VA and VA care. Only about 40% of veterans who have access to VA health insurance use it, which could, there actually has been a huge push nationally to end veteran homelessness. And so that's not as much of an issue anymore, but homelessness was one of the things where veterans were not getting the care that they needed. So it's very possible for veterans to get the care that they need. We just need to point them in the right direction. One way to help veterans get the care that they need is VA social workers. One thing that's important to note is VA social workers are available to families and veterans, but families may have to ask for the connection. They may not be aware the resources available. So like at the Centers of Excellence, social workers are available for all the families that go through the program. You don't have to ask for them. With the VA, sometimes you actually have to ask for the connection. And social workers help with a variety of areas like assessment, crisis intervention, high-risk screening, discharge planning, etc., case management. And social workers can be a very useful tool in helping complete the referral paperwork to get care at a Center of Excellence. Because with these referrals, the VA will cover the medical appointments and the care at an outside facility, but the correct paperwork has to be done in the first place. So what are some additional VA benefits that will also help HD families? Well, there's something called the Veterans Pension Benefits. This provides monthly payments to wartime veterans who meet certain requirements. First, the person can't have a dishonorable discharge, and their yearly family income and net worth has to meet certain limits set by Congress. If those criteria are met, then one of the additional things have to be true. It says you have to have served at least 1 day during wartime, just 1 day. And if you served at least 1 day during wartime, one of these things have to be true. You have to be at least 65, you have a permanent and total disability, you're a patient in a nursing home for long-term care, or you're getting Social Security disability insurance or supplemental security income. So what this means is getting Social Security disability can help a veteran get additional veterans benefits. That's really important to note. Again, we want to make sure these families are getting all the benefits they're entitled to. Another thing that's really important is veterans have access to something called an aid and attendance benefit. This provides additional monthly payments on top of a VA pension, and a person has to be getting a VA pension on one of the following activities. And I just talked about the pension on the last slides, but the person has to have difficulty performing daily activities of daily living. They have to stay in bed or spend a large portion of time in bed. They're a patient in a nursing home due to loss of mental or physical abilities, or their eyesight is limited. A person with HD who is also a veteran is going to fall under these criteria at some point in their life. And aid and attendance benefits provide reimbursement for home care, adult daycare, boarding care, assisted living, and skilled nursing care. This is really important because the only way to pay for these things if you don't have the aid and attendance benefit is if you have Medicaid or you're paying it out of pocket. Another program to consider for veterans and how it would positively impact an HD family is the VA Home Loan Program. This program helps veterans build, buy, or improve a home or refinance. This is really important to know because HD families may need to make modifications to a home to accommodate an individual with HD. They could use the VA Home Loan Program, or a family may need to buy a new home to accommodate an individual with HD, like if they have a 2-story home, but now they need to buy a ranch home. There's also a really great program called the Interest Rate Reduction Refinance Loan, and this can reduce monthly payments and can make monthly payments more stable, which would be beneficial for a family when they have to go on disability and have a reduced income. So that covers all the information in my presentation today. If you'd like, it'd be really great if you could take my webinar survey, which will be sent out to you after the presentation is over. Oh my gosh. But are there any questions?
Yes, Allison, we do have a few. The first is from a listener who is asking about whether folks can have both VA and SSDI.
Okay. I think I missed the question part of that. Can you say that again?
So she missed whether or not you said that people can have both VA and SSDI.
Yes, you can have both VA and SSDI, and then there's even a certain percentage of the population who technically gets VA, SSDI, and SSI at the same time.
Okay, we had another question. It's a little longer. So my 25-year-old son has a 70% service-connected disability rating. He was diagnosed with disorganized schizophrenia. We anticipate acquiring 100% by applying for the unemployability. We now know by his father's diagnosis that HD is the root of his challenges, actually JHD, and we are getting great care, all the things that would help with HD. But now that we know that HD is involved, do we risk these benefits being removed? And do we keep this HD piece quiet until the symptom progression starts to reveal itself.
Sorry, I was having trouble using my computer. No, there's no reason to keep it quiet because it's not, HD is a genetic condition. Like, it's not like this person was exposed to something during wartime and will get ALS later in life. The only way to really get the care that this person needs is to be upfront. Like, the VA is not going to discriminate against somebody just because they have Huntington's disease. They also have another diagnosis that has been classified. They have gotten their VA benefits through it. The VA, like, this person meets the VA criteria. That's what matters. Also, having Huntington's disease isn't going to change the way the VA treats them. And just so everyone knows, we got this information. The University of Washington Medical Center, HDSA Center of Excellence, has a neurologist who works with HD in the VA hospital, so that's also in Washington State. So there are definitely physicians out there who have an understanding of HD, who work with the Huntington's Disease Centers of Excellence, and they work with the VA. What I kind of gathered when I was doing research for this presentation is it seems like, especially if a doctor works for both the VA and the Center of Excellence, it's easier to provide a comprehensive HD care if the person can get the treatment at the Center of Excellence. It doesn't mean they're not going to get good care with the VA, but again, the VA is the VA. They have specific rules and requirements for what care they can provide and who specializes. And HDSA Center of Excellence is for Huntington's disease. And so it's important to think about that concept. Again, the VA also doesn't specialize in Social Security disability because that's a separate program, separate entity, and HDSA social worker is going to have a lot more familiarity with Social Security and Huntington's disease and how to apply through that process. So really, if you're a veteran and you also happen to have Huntington's disease, it's important to understand how these programs work together, what to ask the VA for help, and when to get outside help, because outside help is available. And it's really important to know that people who don't work in the VA don't necessarily know a lot about the VA system. And I would make that assumption too. If somebody works only within the VA, don't assume they know a lot about systems outside the VA. But everybody is here to help veterans and make sure that they get the care and the treatment that they deserve, and they have those options, and there are plenty of things that are available to them.
Allison, what about Medicare? Are the folks who are covered under VA benefits also receiving Medicare, or are they using the VA's medical system?
I think that ultimately depends on what medical care that they get through the VA, because that was something that I had a little bit of trouble understanding when I was doing my research. Like I said, there's the priority systems and how much you pay for a copay. When you're paying into Social Security disability, it means you're also paying into Medicare. So there are people who could possibly be on, so VA health insurance is generally called like TRICARE or Optimum Health. You could possibly be on that and Medicare at the same time. That's probably not going to be true for a lot of individuals, but I don't see why not. There's probably special criteria for how you could jointly use those benefits. But again, the only way you can get Medicare is if you get approved for SSDI or if you're 65 or older. So I don't see why you couldn't have both of those benefits, but again, not every veteran is using TRICARE or Optimum Health. So sometimes I think it's also a personal choice.
Okay, well, we have a few minutes left before our time is up, so please take a moment if you are joining us late to write your questions in the chat box. Allison is here to address your questions on VA benefits and Social Security today. This presentation has been recorded and will be available on HDSA's YouTube channel in about a week. So if you have missed part of it, or if you'd like to review parts of her presentation, you'll be able to find it there in just about a week.